Hi, welcome to another episode of Hot Takes. I'm about to tell you something that won't come as a surprise at all. You just may not be aware of it, but you won't be surprised by it. There is a group called SHERU, which is the Scottish Health Equity Research Unit. This is a bunch of medical people, academics, professionals, that sort of thing. They get together and they look at policies and they look to see how those policies are actually affecting people. They suggest better policies or change of slight direction, that sort of thing, edits to policies. They suggest what ought to be done, what should be done, what can be done, and then frequently pull their hair out and bang their heads on the table when they see what the SNP are actually doing. They are suggesting that the SNP, and this is the bit you won't be surprised about, don't even know what they're doing. The SNP ministers are bringing in policies that they have zero understanding of. And they don't know if these policies are going to work or are working or would ever work because they don't do their homework. They don't look to see what they're suggesting to see if it's sensible. They're not asking experts. They're just bringing things in off political ideas. They're not bringing them in because they are good. They're bringing them in because they sound good. Often there is a very, very big difference. And this is what's happening. They have no clear understanding whatsoever about their jobs. One only has to look at Neil Gray to see there is a man who is completely out of his depth running the health service. And yet more and more people dying, increasingly waiting longer, cancer care through the toilet, and he just laughs and says it's perfectly acceptable. This is outrageous, really. But the trouble is we're so normalised to it, nobody's getting angry. Isn't that sad? Isn't that really the saddest thing of all? Nobody's even getting angry. Now, what they're saying is that in future, all policies that are going to be debated should, yes, go through committee stage, but they should also go through a professional body review, particularly when it's health. And the professional body must have a viable input onto those policies. Now, of course, the SNP won't like that. They don't like giving up total and utter power. The idea of somebody who actually knows what they're talking about making decisions frightens them because they know that it would reverse just about everything they've done, which is very, very frightening for them. They don't like the idea of, sharing power, shall we say. It annoys them. But this report's come out and it just goes to show that there are failings everywhere. And it is leading to premature deaths throughout the entire health service, particularly, strangely enough, in mental units where the sort of self-ending rate is much, much higher than it has been previously. But this is almost entirely attributable to the SNP. It just goes to show what happens when you let incompetents and idiots hold the reins of power. And it isn't likely to get any better, is it? But at least somebody is on the ball. These academics are seeing it, calling it out for what it is and saying, for heaven's sake, stop what you're doing. Thanks a lot.